How to survive a stroke in the first 10 seconds when you're alone. Doctor-backed advice. Imagine you're in a quiet afternoon. The only sound in your home is the ticking of the wall clock. You've just stood up from your chair when suddenly a strange numbness shoots down from your shoulder to your arm. You try to call for help, but your mouth doesn't obey. You can barely form the words. You attempt to walk, but your left leg suddenly feels heavy, unresponsive. In that very moment, you realize something is terribly wrong. And then it hits you. This is a stroke. But it gets worse. You're alone. No children nearby, no neighbors visiting. Your phone is a few feet away. Time feels frozen. This is what doctors call the 10 seconds of life or death. The window where you have just moments to decide. Will you survive and preserve your chance of recovery? Or will the stroke cause irreversible damage to your brain? Medical research shows that once a stroke begins, your brain loses about 2 million neurons per minute. Within just a few dozen minutes, this damage can turn a healthy person into someone permanently disabled. But what many people don't realize is this. The very first 10 seconds are what determine whether you remain calm and take the right steps, or panic and miss your golden chance. Sadly, most seniors in the US, especially those living alone, aren't prepared to face this moment. Many believe that simply calling 911 is enough. But in reality, during a stroke, even reaching for the phone can become an impossible task. So what can you do to survive a stroke when you're completely alone? What must you do within the first 10 seconds, that tiny window where every action shapes your future? Before we dive into the answer, if you're someone who values real science-backed medical advice, practical tips from doctors to protect your health and longevity, after 60, please hit subscribe to Golden 60 Plus right now. Because sometimes, just one video like this might save your life or the life of someone you love. Why does the brain start dying the moment a stroke begins? Many people still believe that a stroke is just a sudden fainting spell, and that you might simply wake up a few minutes later. But in reality, what happens inside the brain is far more devastating. 1. The mechanism of a stroke. There are two main types of strokes. Ischemic stroke occurs when a blood clot blocks an artery in the brain. This accounts for 87% of all strokes in the US. Hemorrhagic stroke happens when a blood vessel in the brain ruptures, causing bleeding and damage to brain tissue. Though less common, this type is more deadly. Regardless of the type, the result is the same. A blood flow to the brain is cut off, and the brain, like a car engine, needs a constant supply of fuel, oxygen and glucose. Unlike muscles or the liver, the brain cannot store reserves. When the supply stops, damage begins immediately. 2. Time is brain. Neurologists often repeat a powerful phrase. Time is brain. Why? Because every minute, during a stroke, your brain loses approximately 2 million neurons. After gaining 5 minutes, the brain tissue begins to suffer significant damage. After cutting 15 minutes, the risk of keen permanent disability skyrockets. After born 1 hour, the affected brain region is often beyond saving, according to a 2023 report by the American Heart Association. Every by 40 seconds, someone in the US suffers a stroke. Every aging 3 minutes and 14 seconds, someone dies from one. These aren't just statistics, they're urgent warnings. 3. Seniors, the most vulnerable group. When we're young, our nervous system is flexible and resilient. It can often recover from trauma. But after 60, that flexibility sharply declines. Blood vessels become stiffened, more prone to blockage or rupture. Circulation slows down, making it harder for the brain to get blood quickly. Neural reserves are depleted. So when one brain area is damaged, the entire body's function can collapse. This explains why many seniors, after a stroke, may lose the ability to walk, speak, or even feed themselves. 4. The first 10 seconds, a decisive moment. You might wonder, why do doctors emphasize the first 10 seconds? Don't strokes last for hours? Here's the truth. Those first 10 seconds may be the only moment you're conscious and able to act. After that, you may lose mobility, speech, or even fall unconscious. Miss that window and your fate is left to chance. A stroke survivor in California shared his experience. He felt numbness spreading down his arm and instantly sat down and dialed 911 while he could still move his fingers. Just minutes later, he lost his ability to speak. But thanks to that call, an ambulance arrived in 12 minutes, and he made a near-complete recovery too. That's the power of action. 10 seconds can save 10 years of your life. By now, you understand why time is your biggest enemy when a stroke hits. And in the next section, we'll uncover how to spot the early warning signs in a flash, so you never miss the chance to save yourself. Spotting the signs in a flash. When a stroke hits, the most dangerous part is that it rarely announces itself with a sharp, unbearable pain. In fact, symptoms often begin subtly, so subtle that many people mistake them for fatigue, low blood pressure, or just feeling dizzy. That's why being able to quickly identify the warning signs, especially when you're alone, isn't just helpful. It's life-saving. 1. The FAST rule. Your emergency code. Doctors around the world use a simple but powerful tool. The FAST rule. It's an easy-to-remember acronym that can literally save your life. So, F. Face. Try to smile. If one side of your mouth droops or looks uneven, that's a red flag. A. Arms. Raise both arms. If one arm drifts downward or feels weak, it's a warning sign. S. Speech. Say a simple sentence like, "The weather is nice today." If the words come out slurred, jumbled, or unclear, take it seriously. T. Time. If you see any of the above signs, don't wait. Call emergency services immediately. FAST is simple, memorable, and has already saved millions of lives. 2. Other symptoms you shouldn't ignore. Not every stroke follows the FAST checklist perfectly. Some people, especially seniors, may experience different symptoms, including sudden vision changes, blurry sight, double vision, or losing vision in one eye, loss of balance or coordination, sudden dizziness, unsteady walking, or falling. See someone severe, unusual headache. Especially in those who rarely get headaches, this can indicate a brain hemorrhage. Nausea, dizziness, vomiting. Occurring suddenly without any clear reason. Numbness or weakness on one side. Starting from the face and moving down the arm and leg. Many people make the mistake of thinking they just need to rest a little. But the truth is, strokes don't go away on their own. They only get worse by the minute. 3. Why you must act at the first suspicion. A Harvard University study found that among patients who experienced mild stroke symptoms but delayed medical attention, 40% suffered a full-blown stroke within 48 hours. This means, if you ignore the signs, you're gambling with your life. Neurologists often say, if you suspect a stroke, treat it as if it is a stroke. Because acting early never hurts, but waiting too long could cost you your future independence, or even your life. 4. Move in a blink. Oh. As we discussed earlier, the first 10 seconds might be the only moment you are fully aware and physically able to act. So the moment you detect any of these warning signs, treat it like an alarm bell. Don't brush it off as just a dizzy spell. Don't reach for sugar water or a cup of coffee. Instead, get ready for the survival steps we'll cover in the next section. In the next part, we'll walk you through 5 critical actions you must take in those first 10 seconds. Simple steps that could mean the difference between life and death. 5. Life-saving actions in the first 10 seconds. When a stroke strikes, you don't have time to think. Your body weakens by the second. Blood flow to your brain is cut off. And if you panic, you may lose your only window to survive. These are 5 critical steps doctors recommend. Burn them into your memory because one day they might save your life or someone you love. 1. Sit or lie down immediately. Do not try to stand or walk. The risk of falling is dangerously high. A single fall can lead to a hip fracture or brain injury, which can be instantly life-threatening. If possible, sit with your back supported against a wall or sturdy chair. If you feel yourself going down, try to lie on your side to keep your airway clear. This safe position helps you stay conscious longer and reduces further injury. 2. Call 911, even if you can barely speak. If your hand still works, dial 911 immediately. Even if your speech is slurred or hard to understand, the dispatcher will recognize something is wrong and treat it as an emergency. If you can't speak at all, just keep the line open. Emergency services can trace your location, and sometimes background noise helps first responders understand the situation. 3. Loosen tight clothing and unlock the door. Loosen anything restrictive, collars, belts, jackets, to help improve blood flow. If you're able, unlock your front door or the nearest window. This tiny detail is often overlooked, forcing paramedics to waste precious time breaking in, and you lose critical minutes that could have saved your brain. Remember, every minute of delay equals more brain damage. 4. Control your breathing and stay calm. Panic makes things worse. It spikes your heart rate, increases blood pressure, and accelerates the damage. Breathe deeply and slowly. Focus on every breath. Deep breathing brings more oxygen to your brain, and even a little more can extend your survival time. Some neurologists recommend a simple rhythm. Count 1, 2 to 3 while inhaling and 1, 2, 3 while exhaling. This rhythm calms the brain and helps you stay conscious longer. 5. Do not take any medication. Many people instinctively reach for aspirin, thinking it will prevent clots. But if you're having a hemorrhagic stroke, bleeding in the brain, aspirin can make things much worse, causing more bleeding and rapid brain damage. Only a hospital scan like a CT or MRI can confirm the type of a stroke and determine the right treatment. Taking medication now is like gambling with your life. Final message. These 5 actions can be done within the first 10 seconds, and they might be all you need to buy precious time before help arrives. Don't underestimate their simplicity. Many people don't even manage to do the first step. Sit down and protect themselves. If you've found this information helpful, hit the subscribe button for Golden 60 Plus right now. Because one day, a single click today might help you remember these steps when it matters most. Things you must never do during a stroke. In a moment of panic, many people unintentionally make choices that seem helpful, but actually put them in greater danger. Knowing what not to do can be just as life-saving as knowing what to do. 1. Do not drive yourself to the hospital. Many Americans think, if I drive myself, I'll get there faster. But the truth is, once the brain is affected, your coordination and reflexes are no longer reliable. Each year, hundreds of stroke victims lose control behind the wheel, causing accidents on the way to the ER. An ambulance doesn't just get you there faster, it brings oxygen support, vital sign monitoring, and pre-alerts the hospital so doctors are ready for immediate care upon arrival. 2. Do not lie, face down, or use a tall pillow. Some people, out of habit, lie on their stomach or prop their head up with high pillows, thinking it will help with dizziness. But during a stroke, these are dangerous positions. Lying face down can block your airway and increase the risk of suffocation. A high pillow limits blood flow to the brain, worsening the oxygen shortage. The safest position: lie on your side, head slightly tilted, with a low pillow to keep the airway open and neck straight. 3. Do not wait and see if it goes away. This is one of the most common and deadliest mistakes, especially among seniors. Thinking maybe it's just fatigue or I'll feel better in a bit wastes critical time. A stroke does not resolve on its own. Every minute you delay, your brain loses millions of neurons. A Mayo Clinic study found that 30% of stroke-related deaths could have been prevented if the patient had gotten care within the first 1 to 2 hours. The main reason they didn't: they were waiting to see if the symptoms would pass. 4. Do not eat or drink anything. When a stroke hits, your ability to swallow may already be impaired. Trying to drink water, take pills, or eat could lead to choking or aspiration pneumonia. This is why doctors strictly advise: never feed a stroke victim in the early stages, even if they say they're okay. 5. Do not let yourself panic. Panic is fuel to the fire. It spikes your heart rate, sends your blood pressure soaring, and can cause a clot to move faster or a weakened vessel to rupture further. The more anxious you become, the faster your brain runs out of oxygen. Remember, calm is your first medicine in surviving a stroke. Final warning: these don'ts may sound simple, but in reality, they mark the line between life and death. One wrong move can undo everything you did right before. In the next section, we'll explore how to prepare before a stroke ever happens. Because if you live alone, preparation isn't optional. It's the insurance policy your brain depends on. Preparing in advance, because stroke can strike at any moment. One of the harshest truths neurologists emphasize again and again: stroke comes without warning. It can hit while you're cooking dinner, watching TV, or even while sleeping. And if you live alone, your chances of getting timely help can drop drastically. That's why being prepared is your true life insurance. We don't wish for bad things to happen, but being ready is the smartest way to live. Chair 1. Always carry a medical info card. Keep a small card in your wallet, jacket pocket, or on a keychain with this info. Full name and birth year. Existing medical conditions, e.g., high blood pressure, diabetes, heart disease. Medications you take regularly. Emergency contact number. Family or primary doctor. When EMTs arrive, a quick glance at this card can guide fast and safe treatment. 2. Use technology to protect yourself. Most smartphones now have built-in emergency SOS features. You can preset contacts or call 911 with just a few taps of the power button. Smartwatches like Apple Watch, Galaxy Watch, or Fitbit can detect falls, monitor abnormal heart rhythms, and send SOS alerts if you don't respond. Many seniors in the US have survived stroke or falls thanks to these tools. If you're not tech-savvy, consider a medical alert device, a simple wearable button that connects you to an emergency center at the press of a finger. 3. Keep your phone within arm's reach. A common mistake is charging your phone in the kitchen or living room while you sleep in the bedroom. When stroke strikes, even walking a few steps may become impossible. Solution: keep one phone by your bed and another in the living room. Make sure that no matter where you are, help is just a reach away. 4. Post emergency instructions where you can see them. Print out the fast stroke signs, 911 an emergency number, and the key steps. Sit down, call for help. Loosen clothing, stay calm. Stick this in places like the living room, kitchen, or above your bed. During a stroke, memory and logic can fail, but a visible guide can help you respond correctly, even in a panic. 5. Practice mental rehearsal. Here's something people rarely think about: psychological preparedness. Try situation drills once a month. Imagine you're having a stroke, then act out the motions. Sit down, dial 911, loosen your clothes, slow your breathing. By rehearsing this regularly, you train your body to react instinctively, not freeze when it really happens. 6. Build a safety net around you. If you live alone, let trusted neighbors or friends know about your health risks. Set up a system. If you don't respond to texts or calls for 24 hours, they'll check on you. This small network can be the difference between life and death. Preparation doesn't make you weak, it makes you powerful. Because stroke doesn't ask for permission. And only those who are ready ahead of time stand a real chance of surviving it. In the next section, I'll share real-life stories. Some miraculous survivors who were saved thanks to good preparation, and others who missed their only chance because they delayed just a few minutes. These stories prove preparation isn't optional, it's everything. Real-life stories. Lessons of hope and heartbreak, studies, statistics, and medical guidelines can often feel too clinical, especially for older adults. But real stories, they have the power to hit home. They reveal the brutal reality of stroke and the incredible hope that lies in taking the right action at the right time. 1. A miraculous survival story. In Texas, a 72-year-old man named George experienced a stroke while sitting in his living room. He was watching TV when his left arm suddenly dropped. It was completely limp. But instead of panicking, he remembered the fast rule his doctor had once taught him. In less than 10 seconds, George did 3 crucial things. Sat back against a sturdy chair to avoid falling. Reached over to dial 911, leaving the call open. Managed to crawl toward the front door, unlocked it, and collapsed on the floor. Just 15 minutes later, the ambulance arrived. According to the paramedics, if George hadn't unlocked the door, they would have had to break it open, a delay of at least 5 more minutes. And in a stroke, 5 minutes can be the difference between walking again or spending the rest of your life in a wheelchair. The result? Thanks to fast and correct action, George fully recovered. After a few months of rehab, he could walk, talk clearly, and today still plays ping pong with his friends. 2. A story of regret and delay. In contrast, Margaret, 68, from California, also had a stroke one morning. But she assumed it was just a drop in blood pressure from standing up too fast. Instead of calling 911, she chose to lie down, hoping it would pass. 2 hours later, her son stopped by and found her unable to speak, with one side of her body completely paralyzed. By the time the ambulance got her to the hospital, it was too late to administer a clot-busting drug, which must be given within the first 3 to 4.5 hours to be effective. Margaret survived, but from that day forward, she required a wheelchair and lost the ability to speak full sentences. Her family carries the pain of knowing that a delay of just a few hours had cost her a lifetime of independence. 3. Key lessons we must learn: 2 stories. One filled with recovery and relief, one shadowed by loss and regret. Together, they highlight one truth that every doctor emphasizes. The first few seconds can save your next few decades. A delay of even 10 to 15 minutes can change your life forever. It's not about how strong you are. It's about how prepared you are and whether you're clear-headed enough to act quickly in a moment that could mean life or death. In the final section, we'll revisit everything we've learned today. Because stroke can strike anyone, but survival is entirely possible if you know how to use those first 10 seconds wisely. Dear friend, after everything we've just explored together, one truth becomes clear. Stroke doesn't discriminate. It can strike while you're having breakfast, reading the paper, or even sleeping in a quiet home. No one ever expects it. But here's what you can expect. Your chances of survival can increase dramatically if you know what to do in the first 10 seconds. 10 seconds to sit down safely and avoid a dangerous fall. 10 seconds to dial 911, even if your voice is fading. 10 seconds to loosen tight clothes and unlock the door, so help can reach you fast. 10 seconds to breathe deeply and stay calm, giving your brain a little more time. Just 10 seconds. But those 10 seconds can save your entire future. Neurologists call this moment the golden seconds. A brief window where a single decision can mean the difference between growing older with clarity and independence, or living the rest of your life in a hospital bed, dependent on others. No one can stop a stroke from knocking at your door, but you can be ready when it does. And when you are, those golden seconds become your greatest chance at survival. So please, don't keep this knowledge to yourself. Share this video with your friends, your parents, your neighbors, especially those over 60. Because one day, this information might be the lifeline someone you love needs, when every second counts. And if you found today's video helpful, subscribe now to Golden 60 Plus. We're here to bring you practical medical insights, inspiring stories, and real tools to help you stay healthy, happy, and safe during your golden years. You deserve to live each day fully, not in fear, but in peace. With knowledge, preparation, and the belief that you are strong enough to overcome anything. Stay safe. Stay prepared. Stay with us at Golden 60 Plus.